Hello guys, my name is Akanksha. I am from School of Nursing NIU, and today we will see the extended and expanded role of nurses. So first of all we will see the extended role of nurses. So here is the definition of extended role of nurse. So, what is extended role? Extended role of nurse is a activity concerned with the patient either in hospital or community that are appropriate for delegation by doctor to nurse. So, uh, extended role in the sense कि a responsibility or the order which has been given by the doctor, nurse will follow all those instructions in her nursing practice just to provide the nursing care to the patient in the hospital setting or in the community. So, what all are the extended roles? Uh, First of all, caregiver, another one is manager, advocator and protector, counselor. Nurse also works like nurse educator, communicator, rehabilitator, collaborator, school health nurse, occupational health nurse, parish nurse, public health nurse, home care nurse, rehabilitation office nurse, nurse epidemiologist, critical nurse, nurse administrator, nurse practitioner, nurse midwife, community health nurse, occupational health nurse, secretary nurse, medical surgical nurse. So what all are these? Caregiver is a normally all of us we can understand with the word or with the name itself that a nurse works to provide the nursing care to the patient or to the healthcare needy people. So caregiving role is primary role of the nurse. We all of us know this very well, and the nurse at the holistic care need of the client including measure to restore emotional, spiritual and social well-being. So when nurse provides the care to the patient, she restores not only the health status, she also tries to restore the emotional, spiritual and social well-being of the patient through her care. Another one is nurse also work as a manager. Manager in the sense coordinate activity with other health team member, manage their own time and resources, and make the decisions and consult to the professionals like that. So many things are there to for nurses to manage. Another one is protector and advocator. Protector and advocator in the sense what? As protector, nurse help to maintain a safe environment for the client and take steps to prevent injury and protect client from possible adverse effect of diagnostic or treatment measures. She also confirms that a client does not have an allergy to a medicine and provide immunization. Another role of nurse is counselor. So many time, so many people requires the proper counseling, and nurse is the best person to provide the counseling to the persons or to the patients or to the needy people. So nurse helps to explore feelings and attitude about wellness and illness with patient and their family member and provides emotional, intellectual and psychological supports through her counseling sessions. Another one is communicator. The role of communicator is central to all nursing role and activities. So communication with client, with family members, with the other nurses, with the other healthcare professionals and the other community members. So everywhere nurse plays or acts like a communicator. Another one is educator. Explain the concept and facts of health. Also demonstrate the procedures uh, and use for component of teaching, assessment, planning, implementation, and evaluation. So how a nurse work like a educator nurse, a trained nurse teaches to the newcomer or beginners or the student nurse, and in the hospital setting nurse educates the people about a certain procedure which they have to perform in their household settings, or many more things, or many more places where a nurse plays a role of educator. So through these four component, nurse teaches to the others through the assessment, through the planning, with the good planning, through implementation, and by the evaluation. Another one is rehabilitator. Nurse also helps the person to restore their health status and their day-to-day life. So, rehabilitation is the process by which individual returns to maximum level of functioning after illness, accident, and other disability events. So here, nurse plays a very important role. How nurse teaches the person how that person can come back and can go back to the normal healthy life. So nurse motivates the people to do their day-to-day activities, like that person used to do earlier before the illness. So nurse plays a very important role in as a rehabilitator. Collaborator. School health nurse. In the school, nurse used to assess the students, those who are coming in the school, their health. She used to check their health status. She used to check their well-being and all. Then another one is occupational health services. In the MNCs, in the so many companies, and the so many organizations are running, those who are appointing the nurses to maintain the health status of their workers, of their employees. So, occupational and environmental health nurses, especially practicing that provide for delivering health and safety program and services to the worker and community group. The practice focuses on promotion and restoration of health, prevention of illness and injuries, and protection from environmental hazards. So, if nurse is there in any MNC, then nurse can tell them or teach them how to maintain, uh, teach them, means the employees, those who are working over there in particular organization, can teach them how to maintain their health status, and also can protect or provide nursing care during any emergency situation. Then another one is parish nurse. In the churches or in the temples, nurse can provide the nursing care. Also encourages the people to improve their spiritual health and their mental health as well as their physical health. So nurse can work as the parish nurse as well. Another one is public health nurse. So obviously, public health nurse means registered nurse, can work with the community peoples in the different areas where she used to serve herself to fulfill the health care needs in the community. Another one is rehabilitator nurse. Nurse can also work as the rehabilitator. Another one is official nurse. Sometimes nurse provide patient care along with physician in this setting, such as physician office or medical office. So that is physician nurse. Physician epidemiol. Sorry. Another one is critical care nurse. So in the critical situation, nurse can provide nursing care, and for these nurse has to do certain courses after the nursing care to get the specialized in the critical situations. So in all, after doing all those courses, nurse may able to handle the critical situations specially, and can suggest and help the others to perform the nursing care in the critical situation. Another one is nurse administrator. So nurse administrator is also a very important role of a nurse to delivering the nursing services in the uh, hospital settings. So a nurse can plan, or nurse can plan the budget or staffing pattern, and the also plays a very important role in the administration, especially nursing administration department. So nurse also plays an important role in nursing administration. And another one is nurse practitioner. Already we have seen that with the physician's clinic, or in the private setting or in the hospital setting, nurse when where nurse helps to the physician, nurse plays a role of nurse practitioner. Then acute nurse practitioner, adult nurse practitioner. Here nurse provide care to the adult people with the chronic illnesses. Then family nurse practitioner means nurse provides the counseling and guidelines, or guide to the family members in the ambulatory care, primary ambulatory care. Then women's health nurse practitioner. Here nurse works to improve the women's health status. Then geriatric nurse practitioner. Here nurse practices uh, to provide nursing care to the old age peoples. Here in this, nurse gives more emphasis on the health promotion of elderly people, and the maintenance of health status and functional status, and provides the nursing care to promote the uh, health status of the elderly people, and also helps the elderly people in the self care. Then nurse midwife. The nurse midwife means here in this, nurse provides care to the pregnant women's, and during delivery, and also provide nursing care to the newborn. In the gynecological services, in the community health nurse, she plays a very important role, that where nurse serves herself uh, to promote the health status of the community through home visiting, through ANC and PNC, and through collection of information, and by collecting data, through providing health services in schools and health educations in school or to the community people. Then another one is occupational health nurse. that we have seen that it is a branch of public health nursing where uh, nurse appoints or provide nursing care in the industries or in the MNCs or companies as per the need of the workers. She used to provide healthcare services. Then secretary nurse, medical surgical nursing. Now we will see what all are the expanded role of nurses. So till now we were seeing the extended roles of the nurse. So extended role of the nurse were the instructions or actions she was doing as per the instruction of the doctor in the community as well as in the hospital setting. But expanded role, what it is, we will see. Expanded role of nurse is the responsibility assumed by the nurse within the field of practice. And what is the definition of the expanded role? Expanded role of nurse means enlargement of nursing within the boundaries of the nursing. So she'll be in the hospital and clinical setting or in the college setting. She'll be providing nursing care to the people. So expanded role of nurse are advanced nurse practitioner, clinical nurse specialist, nurse anesthetist, nurse researcher, nurse educator, acute nurse practitioner, nurse entrepreneur, operating home nurse, travel nurse, nurse oncologist, nurse informatics, sport nurse, hospice nurse, space nurse, tele nurse, cruise nurse, disaster nurse, nurse as educator, no sorry, author, epidemiological nurse, and so advanced nurse practitioner, a nurse who has an advanced education and is a graduate of nurse practitioner program, is employed in healthcare agencies. Another one is nurse clinician or nurse specialist nurse. So clinical nurse specialist has a master degree in the nursing and expertise in the specialized area of practices. Then nurse anesthetics, nurse especially trained in the anesthetic department or anesthetic education has taken by the nurse. Then nurse researcher, a nurse researcher may be employed in a academic setting, hospital or community service agencies where she investigate the problem to improve nursing care and standard the nursing care. Advanced nurse educator, the nurse educator is usually degree holder and more advanced and frequently expert in particular area of practices. Then acute care nurse practitioner function in setting where critically ill patient reside. This type of nurse provides special expertise. Nurse entrepreneur. Nurse entrepreneur is an individual who organize, operates, and assume business such as independent nursing practice, consultant services, etc. Another one is operating room nurse. We can say OT nurse. So when patient are admitted before and after surgery, the operating room nurse monitor the patient's progress. Travel nurse, during traveling, nurse provide care to the travelers. Another one is nurse oncologist, advanced oncology nurse practice. It means practice of expert and leadership in provisional care to individual with an acute and potential diagnosis of cancer. Another one is nurse informatic, nurse analyst. A nurse analyst must have a strong statistical background and be able to interpret data in a logical manner. So, nurse analyst must be able to work on multiple projects at one time, focuses on detail. Sport nurse. yet official, but yes, we can say that a nurse who specially works in the fitness department of members, those who are actively participating in these sports like players and all. Then another one is hospice nurse. Hospice nurse, in the sense, hospice and palliative care include 2 hour nursing availability, management of pain and other symptom in family support. Hospice provide promote quality of life by protecting patient from burden, some intervention and providing care at the home. Another one, space nurse provide on the ground monitoring and a full range of health services to astronaut uh, who are screened to determine if they meet the NASA health requirement. Telenurse, those nurse who provide nursing care to the long distant patient where the healthcare facilities are difficult to reach immediately. Then cruise nurse, nurse who works on ships and resorts. And disaster nurse means specially trained nurse who are specially trained in for the emergency situation, and they provide nursing care in the disaster management. Nurse as an author, nurse also work like a author, and there she publish the article in the journals and all, and inform the others by writing her things, by the upcoming healthcare needs and all. Epidemiology nurse investigate trends in group or aggregate and studies the occurrence of disease and injuries, and the information is gathered from census data and statistics and reportable disease records. So these all were the expanded role of the nurse.